Our doctor in the house from University Hospitals today is Dr. Robert Haber, dermatologist, and we're going to be talking about hair transplants. And Dr. Haber, this is a subject that is of interest to very, very many men. And my first question is can it be done reliably, safely, and when you look at the fella, you can't tell that he's had a hair transplant? I know years ago, you can tell when a guy had a hair transplant.
Well, that's the main message we're trying to get across to the public, is that the general impression and image and history of hair transplantation, which is of a bad quality result with big visible plugs, the doll's head look, should be a thing of the past. And with micrografting techniques, which is what modern surgeons are able to do, we basically can do undetectable surgery. So what we want to do is move hair from portions of the scalp that we know the hair will grow forever, move it to areas of the scalp that have lost their hair, and have that result be undetectable.
You said a micrograft, so that means you do one hair at a time?
Well, we can do is, the smallest graft we use has got a single hair in it, and the largest graft will contain about 3 or 4 hairs. And the reason for that is 3 or 4 hairs will naturally grow from the scalp from one small area. But larger than that, it becomes tufted, which means visible. That's the doll's head look. So I use a technique called total micrografting, where everything is a tiny graft containing only 1, 2, or 3 hairs, and in that way, in this photograph that's being shown right now, on the bottom you can see the old-fashioned plugs. Above that you can barely see, but there are 10 micrografts, each of them containing a single hair. That's the size that we use, and when we're using that size, when the hairs grow back in, no one is able to tell that surgery was done.
We have a caller on the line. Your question for Dr. Haber. Go ahead, please.
Yeah, about September of '94, I had a hysterectomy, and I've been losing hair in big clumps, like when I brush it right after a shower. I've got tons of hair falling out, and then it stops for about 3 weeks, and then it starts again. Is there anything I can do to stop that? Well,
that's a common problem after significant illnesses, sometimes medications and infections. It has a particular name called telogen effluvium, and usually it's self-limited. That type of hair loss is probably not going to respond to a hair transplant, but to be certain, you really should come in and see a dermatologist, have your scalp looked at very carefully, and we can discuss a variety of things that might be possible to do. There might be some injections that could work. It doesn't sound to me that surgery is going to be your solution, though.
You have some photos, Dr. Haber, of one of the fellows that you worked on. This is a typical male pattern baldness, what you might call?
This is a person with extensive male pattern baldness. Some people think if they've lost too much hair, they're not a good candidate, but the opposite is true. The more hair you've lost, really, in some ways, the better candidate. This person had been using a comb-over, had been unsatisfied with that, and in 4 sessions were able to move quite a bit of hair.
That's the same guy?
That's the same person.
Wow.
After about 4 sessions, separated by about 4 months apart. And you can see it's a very natural look. You don't look at that person and say he was transplanted. And that's the type of look that we're able to give someone who's lost even a huge amount of hair.
Right. You can't take a guy that's totally bald and, like you said, make him look like Ronald Reagan, but you can reverse the process.
Right. The people that we eliminate from surgery is someone who has unreasonable expectations. Someone comes in who's 25 and they want to look like they looked when they were 18. Well, we just can't do that. So instead, we want to give them a look that's going to look good for the rest of their lives, when they're 50 and 60 and 70 and 80, and really there's no age that's too high for us to transplant. We want it to be natural and undetectable for their whole life.
Let's take another call. You're on the air with Dr. Robert Haber. Go ahead, please.
Hello?
Hello, you're on. Okay,
yes. I have always had a thinning hair problem. It runs through my family, and I tried Rogaine, and it didn't do nothing. If anything, it made me lose my hair more. What would you recommend?
Yeah, what about Rogaine for women or men?
Well, Rogaine is not a bad medicine for certain types of people. If you've lost a relatively small amount of hair, or if you have the problem that you have, which is just some thinning, Rogaine is probably your best bet. Again, for transplantation, you've got to have lost enough hair to make the expense and investment in the surgery worthwhile. Rogaine is probably your best bet. There are some other medications that are currently being tested, but really, again, you probably should be seen by somebody so that your particular level of loss could be evaluated, and perhaps some other type of medication or some other problem is going on with you that might be correctable.
Yeah, you said you do about 300 hairs per session, and 4 sessions over several months. How long does that hair last? Does it last for a lifetime, or is there a chance that it'll fall out again?
Well, the hair that we move is growing from the rim on the sides and back of the head that we know will last forever. So the hair that we put in lasts forever. That's why we have to be so careful about where we put it, about our patient selection, because it's not a process that's easy to reverse. So we've got to do a good job from the first
The good news from Dr. Haber is, fellas, there is hope. Call Health Match at University Hospitals, 844-3980 for more information about hair transplants. Thanks for being with us, Dr. Haber, and we'll have more of News Center 8 in just a moment.
Thank you.